people is a core pillar of the values that the institution practices. And so wellness has always been a part of the employee experience, where they have nurses and doctors and somebody focusing on well-being. But initially, well-being just looked like biometric screenings until we got the WebMD solution, which now put wellness at your fingertips. And it gave us an application and a tool that allowed us to have a wellness hub. And so I think that shift allowed us to do way more in terms of population health, making it more accessible and making sure that people had more options.
When we were looking at how to have a digital platform for wellness, or even when we approach wellness, we really have to make sure it's backed up by science. It's evidence-based, and WebMD really helps us with that through the different products and the staff that they have.
I would say another really important part of that effort is making sure that managers at the institution can speak to the solution. And so it's important that we are measuring how many of our leaders are participating, so that they can understand the business case and how it relates back to productivity, but also they can encourage others to do so.
We really have to be creative with what type of communications we're pushing and how we're approaching wellness for everybody, because it's not a one-size-fits-all. We really get to customize the voice and the language that we're putting out through the WebMD created communications. So if we feel like health coaching might not be utilized a lot right now, or there's a certain area we can go to depending on our population's data and demographics, we can really try to push communications towards that.
We are a small but mighty team, and so when we are servicing 9,500 employees that are multi-segmented across the institution, it's impossible to get to everyone. And so having a solution like health coaching, it allows us to spread ourselves a little bit more in terms of the one-on-one personalized support that people are looking for. The partnership with WebMD, they're along for the ride. We call them honorary working well, because they also have to be able to pivot along with us. And we've definitely made some changes along the way, which WebMD has kept up with.
The team we get to work with through WebMD is the dream team. I feel like we've really built a relationship and nailed down what our workforce wants to hear, what our culture is like, and WebMD is really able to help us get those metrics that we're looking forward to.
We let WebMD lead the way because they're just so turnkey, and they know exactly how to speak to the metrics and the impact that the solution has for our population.